Good morning. We will hear many people talking to us about something called neurogenic bladder. What does neurogenic bladder mean? Quite simply, neurogenic bladder is a disorder in the muscles of the bladder. The bladder is supposed to have muscles that contract to allow urine to pass through the urethra. Sometimes there is a disorder in the bladder muscles causing involuntary contractions. So what are the symptoms of neurogenic bladder? The symptoms include a constant urge to go to the bathroom due to these contractions. We might experience urgency, meaning we have a sudden and intense need to go to the bathroom immediately, all at once and suddenly. Sometimes the situation can escalate to something called urge incontinence, where we feel this intense urge and might not make it to the bathroom in time, resulting in urine leakage. So, what are the most common causes of overactive bladder or neurogenic bladder? The most common cause, of course, is inflammation. When there is inflammation in the bladder, bacteria adhere to the inner wall of the bladder and it causes irritation whilst there. So we often find that women complain more about this issue. They have a frequent urge to go to the bathroom even though the bladder is empty, and sometimes they feel as if the urine is trapped, meaning they are unable to urinate. On the contrary, the bladder is empty. They feel like the bladder is full and experience contractions, but the bladder is empty. That's the first cause, inflammation, and this is actually the most common cause. There are many other causes, including diabetes, things that generally affect the nerves, and sometimes, of course, spinal cord injuries. But this is a slightly more advanced stage. It reaches a certain stage. That's a completely different topic. But as we agreed, the most common cause is inflammation. And sometimes there is no cause. How can there be no cause? Just like some people have irritable bowel syndrome, for example. Some people have a neurogenic bladder. So, how is it treated? In fact, there are some medications that reduce bladder muscle contractions. But before we administer this medication, we need to ensure certain things. First, that there is no inflammation. Because as we agreed, the most common cause is inflammation. So the most important thing is to ensure there is none by doing a urine analysis and urine culture. Ensure there is no inflammation. We perform an ultrasound, especially for men, to be sure, to ensure that there is not a lot of urine remaining in the bladder after urination. Because the amount of urine remaining in the bladder after urination in prostate patients can cause the same retention and overactivity. In prostate patients, we want the bladder to contract more to empty it. If we perform an ultrasound and discover or find that the patient is emptying his bladder well, despite having an enlarged prostate, we give him treatment for the prostate and treatment to reduce these contractions. Because an enlarged prostate actually causes the bladder to also have overactivity, as the bladder contracts against resistance, meaning there is resistance, and the bladder contracts to expel urine, leading to hypertrophy or an increase in the muscular strength of the bladder muscles, which causes it to become overactive. Okay? In some cases like this, the pressure inside the bladder with these contractions becomes very high, and this is truly a problem because it can cause reflux to the kidneys and an increase in kidney function. So we give the patient treatment for 3 months, and if the patient does not respond, after 3 months, we perform something called a urodynamic study. If we discover that the pressure inside the bladder is high with these contractions, we inject Botox, similar to cosmetic Botox, but we inject it into the bladder muscles to reduce the overactivity. In the end, if you have the symptoms I mentioned, if there is any frequent urge to go to the bathroom, an urgent need to go to the bathroom, an urgent need with lack of bladder control, visit your urologist and get tests done. And God willing, you will find a treatment. I hope you benefited from the video. Like our channel to see the rest of the videos. Peace be upon you.